My name is Mike, and I have taught human anatomy and physiology for almost 6 years now. If you are preparing for any professional nursing and midwifery council exams, then these anatomy and physiology questions are for you. Though this might not be the direct questions you will encounter in the exams, but trust me, if you can answer these questions, then you are fully prepared for the anatomy and physiology sections of the exams. Number one question is from the cell cycle. Which of these is not a major phase in the cell cycle? A. Interphase. B. Cell division. C. Prophase. D. M phase. So the correct answer is C, prophase. So prophase is not a major phase in the cell cycle. It is a subphase in the cell cycle under mitosis and meiosis, which belongs to the M phase. Number two question is from body cavities. The most superior body cavity is it oral cavity, cranial cavity, nasal cavity, or abdominal cavity? The correct answer is B, cranial cavity. So the cranial cavity is the most superior or uppermost cavity. Number three question is from planes and sections. An imaginary line that divides the body or an organ into equal left and right sections is it frontal plane, sagittal plane, median plane, or transverse plane? So the correct answer is C, median plane. So the median plane can also be called mid-sagittal plane, and it divides the body or an organ into equal left and right sections. Number four is from body cavities. Where is the thymus found in the body? Is it in the cranium, mediastinum, pelvis, or neck? So the correct answer is B. The thymus is found in the mediastinum of the thoracic cavity. Number five question is from levels of structural organization. And the question is, the most fundamental level of human structural organization is it cellular level, chemical level, organ level, or tissue level? So the correct answer is B, chemical level. So the chemical level is the most fundamental level of human structural organization. Number six is still from levels of structural organization. And the question is, the most basic independent level of structural organization is it the system level, is it the organism level, organ level, or cellular level? So the correct answer is D, cellular level. So the cells are independent. They can carry out all the features of living things like movement, excretion, reproduction, and so on. Number seven is from cells. And the question is, in the internal environment, cells are bathed in a fluid called, is it cytoplasmic fluid, intracellular fluid, interstitial fluid, or cytosol? So the correct answer is C, interstitial fluid. So this is the fluid that's actually found between the cells. Number eight is from homeostasis, and the question is, which of these processes is not regulated through positive feedback mechanism? Is it blood clotting, blood pressure, normal labor, or breastfeeding? The correct answer is B, blood pressure. So blood pressure is regulated through negative feedback mechanism, not positive feedback. Number nine is from embryology, and the question is, a zygote develops from the fusion of dash and dash, spermatozoon and oogonia, oocyte and spermatocyte, spermatid and egg cell, oocyte and spermatozoon. So the correct combination there is D, oocyte and spermatozoon. So oocyte is a female gamete, while spermatozoon is a male gamete. Number 10 is from cells. The plasma membrane has dash layers of phospholipids. Is it 1, 2, 3, or 4? So the correct answer is B, that is 2. So the plasma membrane has 2 layers of phospholipids or phospholipid bilayer. Number 11 is from cells. So which of these cells lack nucleus? Is it monocytes, neutrophils, basophils, or erythrocytes? The correct answer is D, erythrocytes. So erythrocytes are red blood cells and they don't have nucleus. The mature ones do not have nucleus. Number 12 is from cells. Which of these cells will have the highest amount of mitochondria? Is it keratinocytes, myocytes, erythrocytes, or osteocytes? The correct answer is B, myocytes. So myocytes are muscle cells and they are the most active cells in this group. So they will need the highest amount of mitochondria. So before we continue, please, if you are learning something from this video, please give me a thumbs up by clicking on a like icon on your screen. And this is just part 1 of this series. So if you've not subscribed to this channel, do well to hit that subscribe button right now so you will not miss the other parts. Number 13 is from cells. Ribosomes synthesize proteins from dash. Is it amino acids, peptides, glucose, or pepsinogen? The correct answer is A, amino acids. Number 14, sister chromatids of a chromosome are usually connected at the, is it centromere, centrosome, centriole, or kinetochore? So the correct answer is A, centromere. So sister chromatids of a chromosome are usually connected at the center, known as centromere. Number 15 is from cells. The passive movement of water down its concentration gradient is termed diffusion, osmosis, active transport, bulk transport. The correct answer is B, osmosis. So when you're talking about movement of water, you are referring to osmosis. Number 16 is from tissues, and the question is, the lining of the heart is formed by, is it simple squamous epithelium, simple cuboidal epithelium, stratified squamous epithelium, or stratified cuboidal epithelium? The correct answer is A, simple squamous epithelium, and this lining forms the endocardium or inner layer of the heart. Number 17 is from tissues, and the question is, the most abundant tissues in the body are, is it epithelial tissues, connective tissues, muscle tissues, or nervous tissues? So the correct answer is B, connective tissues. So connective tissues are the most abundant tissue types in the body. Number 18 is from tissues, and the question is, the cells that produce collagen are, is it adipocytes, fibroblasts, mast cells, or plasma cells? So the correct answer is B, fibroblasts. Fibroblasts are the ones that produce collagen and are the most abundant connective tissue cells. Number 19, the following are skeletal muscles except, is it diaphragm, detrusor, bicep brachii, or gluteus minimus? The correct answer is B, detrusor. So detrusor is a smooth muscle. It's not a skeletal muscle, and it is found in the bladder. So that's what helps to expel urine. Number 20, which of these muscles lacks striations or stripes? We have arrector pili, myocardium, rectus abdominis, and deltoid. So the correct answer is A, arrector pili. So arrector pili is a smooth muscle, and smooth muscles do not have striations. So it's a muscle that is connected to your hair, and that is actually what gives you goosebumps sometimes, like when you're cold. Number 21 is from tissues, and the question is, Which of the following is not a major membrane? Is it serous membrane, cutaneous membrane, pleural membrane, or mucous membrane? So the correct answer is C, pleural membrane. So the pleural membrane is not a major type of membrane. It is a type of serous membrane. And the pleural membrane is the membrane that covers and protects the lungs. Number 22 is from tissues. Which of the following is not a secretion from an exocrine gland? Is it earwax, glucagon, sweat, or salivary amylase? The correct answer is B, glucagon. So glucagon is a hormone, and hormones are secretions from endocrine glands, not exocrine glands. Number 23 is from tissues. Secretions from endocrine glands are called dash. Is it enzymes, juices, hormones, or acids? The correct answer is C, hormones. So hormones are secretions from endocrine glands like I mentioned earlier. Number 24 is from anatomical terms. The femur is proximal to which of these bones? Is it fibula, scapula, hip bone, or humerus? The correct answer is A, fibula. So in the lower limb, you have the femur before the fibula. You have the femur in the thigh, then you have the fibula in the leg. Number 25 is from terms. Brachial is the regional term for what? A, hand, B, forearm, C, arm, D, upper limb. And the correct answer is C, arm. So this is just part 1 of this series. I'm going to be dropping the second part very soon. So make sure you subscribe to this channel if you've not done so, and give me a thumbs up if you learned something from this video. Thank you so much, and see you in the next one.